Health Secretary Sajid Javid is with us. Do you remember where you were when it happened?
Yes, I do. I'll never forget. I was working on the trading floor in the city. And one thing I won't forget is that we had a live sort of phone connection at all times with our trading floor in the World Trade Center. And we could hear the sounds and the noises coming live down the line. And I'd never forget that. No one could.
Did all your colleagues get out?
Yes, they did. Almost all of them, sadly. Some did not.
20th anniversary, can't believe it really, can we? I want to talk to you about health and social care in just a second, but given that we're talking about that, can I ask you about Afghanistan? The Taliban's appointed a caretaker government. One of the people, the Interior Minister, is on the FBI's most wanted. Are they people that we can do business with?
Well, I would say in the last 24 hours, I haven't had much time to look at the Afghanistan caretaker government, but I think that as a general point that now the Afghanistan clearly seem to be in charge, that we need to keep under review how we work with them, but it's also going to be in our long-term interest to make sure that we can continue to help people in Afghanistan, especially those people that we have commitments to that are still trying to leave.
We can work with a terrorist government there, can we?
No, I'm not saying we should recognise the government. The Prime Minister has been very clear about this, that if we eventually formally recognise a government, then there's certain things that we will be looking for, not just in behaviour, but how they also deal with other governments as well and some of the plans that they make. But what we should always be doing is looking to find ways to help those people that still need our support in Afghanistan.
Something that you're very comfortable talking about, of course, this morning is health and social care. I read in the papers it's the highest taxes since the Second World War. Are you sure you're in the right party?
Yes, I'm sure of that. And I think what we've announced in the last 24 hours actually is a very conservative thing to do. We are committed as a party to the NHS. I want the NHS to be there for everyone, a world-class health service, free at the point of use, paid through general taxation. I, as a health secretary, when I came into this job a couple of months ago, and I was told that the waiting list, already at 5.5 million, because of the global pandemic and the pressures that's created, could go to as high as 13 million in 3 years' time. I can't tolerate that. I can't accept that. So something had to be done, and I think the British public understand that. Similarly, with adult social care, I think the fact that some people have this risk of catastrophic care of cost, that is not acceptable, where you have some 1 in 7 people that have to pay over £100,000 for their care. And I think it's a very conservative thing to do, to give people that confidence, that to know that their lifetime cost of care can be capped for them. The plan is to cap that at £86,000. I think is the right thing to do. And to do it properly and sustainably, I don't like raising taxes. I want taxes to be as low as they possibly can be. But I think people understand if we want the NHS to be there for us always, doing its job, then we've got to properly fund that. And the same applies to adult social care.
Is this going to be enough money, or will we be potentially looking at more tax rises?
No, I think this is enough money. I mean, this is a very large amount of money. It's around £12 billion a year. So over the next 3 years, £36 billion. It's around 16 billion of that directly to the NHS. That will pay for things like 9 million more checks, scans and treatments, helping to tackle that waiting list. It's also over £5 billion more for the adult social care system, not just paying for that cap, but also a more generous means-tested system, more support for the workforce. These are exactly the kind of changes we need to make.
But only a pound in every 6 is going to go to social care, and that in a couple of years' time. Almost all of it is going to go to the NHS. Can you guarantee that the money will go to social care in the fullness of time?
Yes, the money that we've planned.
Because Damien Green, who you know, a former Cabinet Office Minister, saying
the 5.4 billion will go to social care. That's clearly set out in our plans, and in fact, we're already working. Yeah, yes, it will go.
Okay, because you made lots of promises in your manifesto, and you've broken those.
Well, I'm very happy to talk about that, and the Prime Minister has been very clear on that when questioned yesterday. So he was asked, for example, around the promise not to raise national insurance and other tax rates. And you know what we could have done? The options were we could have just doggedly stuck to that and said, we know there's been a global pandemic. We know that the NHS and social care are facing their biggest challenges in their lifetime. But you know what? We've got a promise on taxes, and we're not going to touch them, and therefore people will just have to live with this risk. And that's not what a responsible government would do.
Yeah,
the job of a responsible government is to be honest and to deal with the challenges.
Yeah, my viewers this morning will say, yeah, but you've broken 2 election promises within 2 years.
And I think your viewers will also see through their own regions, the areas that they live, the pressures that are on the NHS. They can see the rise in the waiting list that's already taken place to 5.5 million. And just imagine if it was going to go to 13 million, if it had been business as usual. That's what's likely to have happened, a 13 million waiting list. That could have been one person in every family on the waiting list. I'm the Health Secretary, Health and Social Care Secretary. I can't have that. And I don't think your viewers want that. And so it has to be paid for. When you're going to pay for that, you can't then just say we're going to borrow it, as some people suggested yesterday. Why don't you just borrow it? Because that's just really putting off the problem and moving it to the next generation. It's just a future tax rise for our young people today. We've got to confront it, and that means everyone paying into it together. And I think the way the Chancellor has come up with the money, which is mainly through this increase in national insurance, the health and social care levy, and ring-fenced it and guaranteed that it will always in the future go to health and social care, I think that's the right way to do it, and it's a very progressive way to do it.
Are you saying that the NHS wasn't in trouble before COVID?
The NHS, of course, it's always, you know, it's the biggest universal health service in the world. It's always had challenges for as long as I can remember. But I think the difference now is that with the global pandemic and what that's unleashed, it's the biggest challenge in living memory. I think it's fair to say that. And I'm full of nothing but praise for everyone that works in the NHS and how they have handled this pandemic. And they also deserve this support, making sure that they've got the equipment that they need, the PPE they need, the new technology that they need, and that we continue to invest. So, for example, one of the things I'll be doing with this money is creating a lot more of what I call surgical hubs. Because if I look at that waiting list, a lot of the waiting is for treatments like, it might be like a hip replacement, a cataract surgery. And if we can create more of these dedicated hubs, we can offer more of these treatments, you know, come rain or shine, every day they're available, while the NHS gets on with other work as well.
So are you saying that this money will guarantee to clear the backlog?
No responsible health secretary can make that kind of guarantee.
So how do you know it's enough money? You started off by saying it was enough money. How do you know?
Because we've worked with the NHS very closely, as you would imagine, and we have thought carefully about the money that's needed. But we've also had to make some assumptions and on things that no one can tell you what's actually going to happen. So with COVID, the pathway of COVID, no one in the world knows what happens next with COVID, so I have to make assumptions about, for example, how much testing we need to do, how much we will spend on vaccines and on PPE. We've also had to make assumptions about the amount of the capacity in the NHS and how we can increase that. So what we've worked out with the NHS, for example, is that the NHS will be able to operate at 110% of its normal capacity a year. So it can get through a lot more treatments and checks and scans than before. So I'm going to be working hand in hand really closely with the new chief executive of the NHS and making sure that together we're doing everything we can. What I can be absolutely certain of is that this will massively reduce the waiting list from where it would otherwise have been. It will hugely tackle it, and that's what I think your viewers would expect me to do.
Vaccinations, let's talk about that, given that we're talking about COVID. Where are we with the booster jabs? Because it depends who you're talking to as to whether or not they're a good idea.
We've received interim advice on boosters, and that was a few weeks ago, and I published it. And that was clear that there should be some kind of booster programme. So I'm very confident there will be a booster programme.
For who?
But in terms of who actually gets it and when, we're waiting for final advice, which could come across certainly in the next few days from the JCVI. And I need to see that advice because they rightly are looking at studies that they've done to look at what should be, should we be mixing vaccines, for example, or should people get the same vaccine? They're also looking at whether it makes sense to co-administer it for everyone with a flu jab as well. So that work is almost done. And based on the timeline that they've given us, I'm confident that we can start the booster programme this month. You
don't always take the advice of the JCVI, though, do you?
I have done, yes,
okay,
and including...
So 12 to 15-year-olds.
Yes, I thought you were going to say that,
yeah,
and I've taken their advice, because what was their advice? Their advice was that they've looked at this, and they are only by statute able to look at the health side of vaccination. They're not able to look at wider issues when it comes to children, such as impact on their education, schooling and things like that. And they've said that they recommended to me, their advice was that you should ask the chief medical officers of the UK collectively for their opinion, because they don't feel qualified to talk about issues that are not in their mandate. I've taken their advice.
OK, so are 12 to 15-year-olds going to have jabs?
Don't know. I haven't got the advice from the, chief medical officers. I would expect... I couldn't put a timeline on them. I think that would have been unfair, because they've got to come to their own judgment independently.
The kids have gone back to school?
Well, the chief medical officers have had about 4 days so far.
JCVI, of course, as we both know, have had significantly longer than that. You would have thought that you'd be able to dovetail that back into kids going back to school.
Well, the chief medical officers is who I'm waiting for now, and I want to give them the breathing space. It's their independent view, and that's exactly what it should be. But I would expect to hear from them in the next few days. How
would you feel about 12 to 15-year-olds of yours having jabs?
I don't think it's appropriate for me to pass a judgment, because I'm waiting for an independent view.
Do you think that 12 to 15-year-olds should be able to overrule their parents on whether or not they should have jabs?
I think we should follow the same rules that we've had in this country under successive governments for decades, which is that you first would try to seek the consent of parents. So parents, we're going to ask all parents for consent. And in most cases...
But what if they don't give it, is my question.
If they don't give consent...
And children still want their vaccination.
Exactly. So if there's a difference of opinion between the child and the parent, then we have specialists that, let's say, that work in this area, the school's vaccination service. They would usually literally sit down with the parent and the child and try to reach some kind of consensus. If ultimately that doesn't work, as long as we believe that the child is competent enough to make this decision, then the child's will prevail.
How do you feel about an October fire break, if necessary? Would you support it?
What do you mean by that?
I mean by that potentially, well, fire break, lockdown, whatever you want to call it, in order to, in some form or another, in order to try to stop the virus getting legs again going into the winter.
Well, I don't think that's something we need to consider.
You didn't think that last year.
Look, it is true that no one knows the future pathway of this virus.
So I'm guessing you'd support it.
So I haven't even thought about that as an option at this point, because I think
the decisions...
as the decisions that we've made in the last few weeks, and certainly in the time I've been Health Secretary, I think they've turned out to be the right decisions. We've shown that
we were being told to eat out to help out this time last year.
Well, I wasn't in government this time last year, so you can get a minister in that was making whatever decision you want to talk to them about. I can talk about the decisions that have been made since I've been in government, and especially around health.
If it means that we won't have another wave, you're going to support a fire break, aren't you, obviously?
Well, I've told you, I think that the policies that we followed so far, they're based on the best information, the best evidence that we can get. We listen to our experts, of course, as anyone would expect. And so when we made the recent decision to start opening up the country, to remove the social distancing restrictions, for example, and other rules, I think that's turned out to be exactly the right decision. And it's not risk-free. When you make these decisions, none of them are risk-free. No one knows exactly what's going to happen.
Nobody wants to be in your shoes. That's obviously I mean, you're doing an incredible job given the challenges that you're facing, but nevertheless...
Thanks very much.
Well, it's true, it's true.
Praise from Kay Burley. Well, that's rare, isn't it?
You better bottle it, because I'm not sure how often it's going to come along. But people at home will want to know whether, when it's October half-term, potentially that could be 2 weeks for kids as a result of trying to stop another wave, third, fourth, fifth wave, whatever we're counting.
Our best defence against another wave or COVID ever taking off again is the vaccine wall of defence. That's been hugely successful. We've got 80% of adults now that are double vaccinated. And we continue to build on that programme. We've just talked about boosters, for example, as well. Last week, I also announced a third dose for those that are immunosuppressed, because, again, we're always looking at the evidence to see what more we can do. The vaccines are working. Yes, there are still infections. Of course, there still are. That's true around the world. But the number of people going into hospital, and certainly those dying, is mercifully low, and that's because of the vaccines.
We're out of time, but we're just about to head to Calais, to our reporter on the boat. £54 million is how much we want to give to the French. Are we getting value for money from them? when it comes to?
Well, I think it's look. It's when I was Home Secretary, I was working with the French on the same issue, and in my experience is that it's really good to cooperate. Look, this is a joint problem between the French and the British, and I think it makes absolute sense to work together, to share intelligence and see what you can do.
OK, it's good to talk to you. I'll have to let you go. It's great to see you. Thanks for joining us on the programme this morning.